Welcome to This Explainer. Okay, today we're diving into what I'd call a true clinical detective story, and it's one that challenges a universally held assumption in veterinary medicine. Honestly, if you've ever spent even a single morning in a vet clinic, you know exactly what we're going to be talking about today. Picture this. It's a scenario every clinic knows all too well. A dog comes in with severe, liquid, incredibly foul-smelling diarrhea. Instantly, your mind jumps to one terrifying culprit. I mean, the smell is just so specific, so deeply necrotic, that the immediate question on everyone's mind is always, does this foul diarrhea automatically equal parvovirus? Well, the short, clinical answer? Absolutely not. We really need to think beyond the virus here. That distinct, unforgettable smell is actually not exclusive to parvovirus at all. And by debunking this myth right out of the gate, we can adopt a much more advanced clinical mindset and figure out what's really going on with the patient. So here is our diagnostic checklist for today. First, we'll look at the Parvo assumption, then the science of the smell. After that, we'll go through the differential diagnoses, and finally, we'll build a clinical matrix. All right, part one, the Parvo assumption. This is that classic knee-jerk clinical diagnosis. So, a dog presents with severe liquid diarrhea, and this intense necrotic odor literally fills the entire room. The immediate assumption is always canine parvovirus. And hey, it's a completely natural reflex for the human brain to connect that very specific scent to that specific virus. But the reality? Multiple conditions cause this exact same presentation. We really have to step back and figure out exactly why this smell is happening in the first place. Moving on to part two, science of the smell. Let's look at the biological mechanisms of severe gut damage. And that brings us to a super important concept, dysbiosis. Basically, this is the condition where commensal bacteria abnormally ferment undigested leftovers in the gut, which produces these really putrid gases. This uncontrolled bacterial party is a major contributor to that foul odor. When the gut takes a major hit, we see this biological trifecta of simultaneous events. Step one is malabsorption, where undigested proteins and fats are just left remaining in the intestinal lumen. That leads right into step two, our friend dysbiosis, where those commensal bacteria start fermenting those leftovers. And finally, step three is mucosal sloughing and hemorrhage. The intestinal lining actually begins to break down, mixing serum and blood with the gut contents. These three steps, working together, literally manufacture that distinct necrotic smell. The result of this whole trifecta? An intensely foul, sometimes even metallic odor. So the takeaway here is absolutely crucial for any clinical setting. Any pathology that triggers these three things, malabsorption, dysbiosis, and mucosal sloughing, will produce the exact same smell that everyone universally assumes is parvo. Okay, part three, the differential diagnoses. It's time to broaden our suspect list beyond just parvovirus. Culprit number one on our list is acute hemorrhagic diarrhea syndrome, or AHDS. You might actually know it by its old name, HGE. This presents with a sudden, explosive onset of what clinicians pretty viscerally describe as raspberry jam-like hemorrhagic diarrhea. And what's absolutely fascinating, and honestly a bit terrifying about AHDS, is that it looks and smells nearly identical to a severe parvo case. It perfectly mimics it on the exam table. Culprit number two brings us into the world of parasitic infections. And we've got a really interesting contrast to look at here, the biters versus the lumen dwellers. We really have to look out for the biters, heavy burdens of hookworms like Ancylostoma canum. They actively bite into the intestinal mucosa and secrete anticoagulants. The bleeding ulcers they leave behind cause dark terry melena or acute hematochezia. Compare that to the lumen dwellers, like roundworms, which just steal nutrients and cause potbellies, but rarely ever trigger that hemorrhagic, foul-smelling presentation. Moving right along, culprit number three is bacterial enteritis. Pathogens like Clostridium perfringens, Salmonella, or pathogenic E. coli, these guys act like absolute chemical warfare in the gut. They release severe enterotoxins that aggressively destroy the mucosal barrier, leading exactly to that rapid, foul, and bloody diarrhea we outlined in our biological trifecta earlier. Then we have culprit number four, which is often known colloquially in the clinic as garbage toxicosis. We're talking about dietary indiscretion and toxins here. A sudden, drastic change in a dog's diet, or simply ingesting spoiled food from the trash, well, that can trigger acute bacterial overgrowth, severe inflammation, and incredibly rapid transit times through the gut, producing that terrible stench. Now, before we hit our fifth and final suspect, we need to define a new term: steatorrhea. This is defined as voluminous, pale, unformed feces with a distinct rancid or putrid odor, resulting from excess fat and protein just remaining in the gut. Notice we aren't talking about dark or hemorrhagic fluid anymore, but rather pale, unformed stool that still carries a uniquely putrid smell. And that brings us directly to culprit number 5, malabsorption and maldigestion disorders. Think chronic conditions like exocrine pancreatic insufficiency, or EPI, and severe inflammatory bowel disease, or IBD. In these cases, a lack of digestive enzymes or chronic thickening of the mucosa leaves massive amounts of fat and protein just sitting in the gut. That undigested matter ferments, resulting in that incredibly rancid clinical picture of steatorrhea we just talked about. Which brings us to part 4, building a clinical matrix. Let's get a tentative diagnosis right on the exam room table. Let's bring all these clues together to turn what is usually a really high-stress situation into a clear, solvable puzzle. We can differentiate the exact cause of the foul smell just by matching it with highly specific clinical symptoms. Explosive, raspberry jam-like diarrhea, think AHDS. Bleeding ulcers and dark tarry melena, you should definitely suspect hookworms. Enterotoxin-driven rapid, bloody diarrhea points straight to bacterial enteritis. Rapid transit and inflammation from spoiled food is dietary indiscretion. And finally, if you see voluminous, pale steatorrhea, lean towards EPI or severe IBD. It's really all about reading the specific signs rather than just, well, smelling the odor. So, that brings us to our final point today. And honestly, it's a big one. If the most unforgettable smell in veterinary medicine isn't actually a guaranteed diagnosis, well, what other ingrained clinical biases might be blinding us in the exam room? It's a pretty provocative question, isn't it? As focused learners, we always have to think critically, look far past our immediate assumptions, and rely on structured clinical parameters to find the real answers. Thanks so much for joining me on this explainer, and keep questioning what you think you know.